this is Dr. G with NBC News, here to answer your questions about the coronavirus. So if you have any questions, go ahead and ask them in the comments and I will get to as many as I can. While we're waiting, I'm going to talk about a couple of things. So the first thing I want to talk to you guys about is non-COVID emergencies. And so a trend that we're seeing right now is that a lot of patients are trying to avoid going to the emergency room. They're afraid of getting the coronavirus. But some of those folks really do need to be going to the emergency room. So we're starting to see situations where somebody who's having a heart attack or a stroke or appendicitis is choosing to stay at home rather than go to the ER because they're so afraid of getting sick. Well, it just doesn't make sense. It doesn't make sense to risk your life because you're afraid of getting the virus and then you end up having something really serious happen like a heart attack or a stroke. And so if you feel like you're having a life-threatening emergency, that you're having chest pain, you might be having a stroke, you're having trouble breathing for another reason, or you're having severe abdominal pain, go to the emergency room, call 911. If you're not sure, call your doctor or call a telemedicine service. And don't wait, call right up front and talk to them about it and try to figure out if you should be going to the emergency room or not. Another thing that you should be aware of is not every community is seeing such a high volume of patients that the ERs are packed. In fact, many of the ERs in this country right now are experiencing what we're calling the calm before the storm. They're actually kind of quiet. There's not a lot of folks showing up. People are too afraid. And so the relative risk of running into the coronavirus is not as high as you might think. So if you are having a life-threatening emergency, definitely seek emergency care. Don't put it off. Don't risk your life over this. Another thing that I want to talk to you about, there's a lot of questions right now going on about when are we going to be able to end the stay at home and what's all this discussion about contact tracing and antibody testing. And so I'm going to go over that with you real quick. And so if we go back to the beginning when this all started, where we had, first we had cases coming in through travel, but then we had a handful of community cases. And it only took a handful of community cases to cause that spike, to cause that rapid rise. And then the virus was out there, it was infecting lots of people, it was doing it quickly. And that's when these mitigation measures started. That's when we started talking about social distancing and washing your hands, and then staying at home and working from home and all of those things. Now, we've actually been seeing somewhat of a positive effect from all of this. We've been seeing that it is working. It is slowing down the spread of the virus. We're not at a point yet where we can say we're done. We still have to continue with the mitigation measures and stay at home. But the thing to consider is what's going to happen when we lift those stay-at-home orders and people start going back out into the community. What is going to stop that virus from spreading again and causing a second wave? And the answer is, if nothing is different when we lift those measures, then there's nothing to stop that virus from creating a second wave. The way that we stop the virus from creating a second wave and spreading in the community is to have something be different when we lift those orders. So what could be different? Well, we don't have a treatment yet. There's a lot of drugs that are being investigated, but we just don't have a treatment yet. We don't have a vaccine yet. The one thing that we do have control over is testing. We can test and make sure that nobody goes back to work or returns to work who is sick. We can test folks to see if they have antibodies, to see if basically they're immune to the virus because they already had it. Or we can test to find out who might be sick. They might have minimal symptoms or may not have symptoms at all. But if we can test to see who is sick and then do what's called contact tracing, where we go and we find out everybody that they've been in contact with and test those folks too and make sure that none of those folks are sick, or if they are sick, that they stay isolated at home and that they don't expose anyone else. Those are the things that we can control. And this is our golden window of opportunity to do that. Those things are going to take time, they're going to take manpower, they're going to take money, we need the testing supplies. So this is that window of opportunity where we can ramp that stuff up, excuse me, so that when we get to that point of wanting to lift those restrictions, we have all of those things ready and available to us so that people can safely go back to work and can safely start going out and socializing again. So now I'm going to turn to some questions. What questions do we have?
Okay, so one question would be in regards to return to work. So obviously, ideally, everyone would be able to get a test to say that they're negative after they've been, possibly positive for the coronavirus or had symptoms. What's the current guidelines for returning to work?
So the current guidelines for returning to work, there is one of two ways that people can return to work. There is the testing-based guidelines, which basically means that when their symptoms are better, they can have a test, and then within the same, I believe it's 42-hour period, they have a second test. And as long as they're both negative, then they can go back to work. If a test is not available, the current guideline is for folks to wait at least 7 days from the start of symptoms and then have 3 days where they do not have symptoms or fever before they go back to work.
Okay. And then Marina just asked, do mosquitoes have the capability to transmit the virus from person to person?
So there is no evidence that the virus can be spread by mosquitoes. In fact, when they've done blood tests, like blood cultures, on patients with the virus, they were not able to isolate the virus from the blood itself. So they're able to get the virus, say, from like respiratory droplets and things like that, but they're not able to find it in the blood itself. So there really isn't much reason to believe that mosquitoes could transmit this virus.
Okay, and I know there's been a lot of talk about different medications that might be used to help treat the coronavirus. Are there any other medications in development right now that to speak of?
So there's a lot of medications that are being tested. So the one that everyone hears about, which is probably at this moment the most promising, is remdesivir. That is an antiviral that was developed for Ebola, and that one is administered through an IV. So you have to be hospitalized in order to receive it. But they are seeing some promising results. We don't have like a smoking gun study that says for sure that this is going to work, but we definitely see some promising results with that one. There are other ones in development as well. One of the ones that I'm keeping an eye on is this one from Emory called EIDD 2801, and that one would be one in an oral form. And so we're waiting on clinical trials for that one. I'd be excited to see what happens there. And there are a few others. There's a favipiravir, which is from Japan. That's a flu drug there. That one is also being investigated as well as an antiviral. And honestly, the list is endless to the other medications that could be supportive care or help reduce inflammation or have other effects in terms of combating the virus and the disease that it causes.
Okay, and Sonia just asked, she said, what about our four-legged friends? Are they either susceptible or can they become carriers if somebody pets them?
Right. So right now there's not any convincing evidence that pets can be carriers or that they can transmit to humans. There was one dog in Hong Kong that kept testing weak positive. It was a patient's dog, and they ended up putting that dog into quarantine. The dog was 17 years old. It died in quarantine, though it's not clear that it died from coronavirus. But that really was not convincing that the animal could actually carry the virus or transmit it to humans. We haven't seen any other evidence as of yet that that's what's happening to contribute to the spread of the virus. The only scenario that I can think of in which pets may be a concern is if someone with the virus is coughing or has respiratory droplets on their hands, pets your dog, and then you go and you pet your dog and you get it on your hands. That's really the only hypothetical situation I can think of, and I think that can be avoided by not touching your face and making sure that you're washing your hands frequently.
Okay, and then there's a little bit of debate and argument and discussion going on in regards to masks. Can you tell us what the guidelines are for masks?
Okay, so we talked about this a little bit the last time. So the primary purpose for wearing a mask is for protecting others. When we are, certainly coughing or sneezing, there are respiratory droplets coming out and can be infectious to others, but even something as simple as talking to someone. And so, you hear that the stay 6 feet away from other people, so that's to keep those respiratory droplets from getting on someone. And then wearing a mask would also keep respiratory droplets from getting on someone. And the main issue that's come up is that there are some people who are minimally symptomatic or asymptomatic, meaning that they don't have symptoms, but they do have the virus. So now the recommendation is that if you're in a situation where you cannot keep a 6-foot distance from others, that you wear a cloth mask to protect them. And that could be the cloth mask or some of the really nice masks that folks are making at home. But again, it's to protect others.
sort of still guidelines in regards to like gatherings or whatnot. So how many people in a gathering? And...
Right. So now every state kind of has their own set of rules, but the general rule of thumb is that you want to make sure that the folks who are at a gathering are able to maintain at least a 6-foot distance from one another. And the number that we've heard thrown around a lot is no more than 10 people. But honestly, if you tried to fit 10 people into this room, that would be way too many people for this space. And so I think more important than an absolute number is the ability to actually social distance, and also things like not shaking hands and, you know, being real careful about touching surfaces and being able to have hand hygiene and things like that. But each state has its own guidelines at the moment, and so I would actually check with your state health department on their website.
So this has been on social media, and Regina just asked, how long will COVID-19 last on a person's shoes who's been out of the house? That's been going around social media right now.
Right. So this is a tough one. There were a couple of studies that came out that put numbers on things like the maximum amount of time that they saw the virus on, say, cardboard, I believe was 24 hours, and then on like plastic and metal, it was 2 or 3 days. Those numbers came out of a lab, an ideal lab environments, so we can't even say that those numbers are accurate. And so for me to be able to tell you how long it's going to last on the shoes, that's a very difficult question to answer. I will say that shoes are something to be aware of. There was an interesting study out of China, out of Wuhan, China, where they went and they swabbed various things in the hospital. And so they had sick patient bed, and they swabbed the railing, and the railing of course had the coronavirus on it, and that made sense. And they swabbed other things. They swabbed keyboards and the mouse from the computer. They found coronavirus on those things. But what was really kind of concerning and eye-opening is they actually found coronavirus on the floors virtually everywhere. So including in the pharmacy where there weren't any sick patients. And so the shoes are definitely a means for that coronavirus to get around. So certainly keep that in mind. Not a bad idea to take off your shoes when you come into your house. Or if you're a healthcare worker, have a separate pair of shoes and make sure you change out of those shoes that you're wearing at work and into a different pair of shoes before you go home, because the shoes are a way that the virus can spread.
So Kathy just asked about Diamox in regards to high altitude sickness, and would that work as a treatment possibly?
So that's an interesting idea. So there are some doctors, some ICU doctors, that are making the observation that the symptoms that they're seeing seem more like high altitude sickness than what we call ARDS, which is acute respiratory distress syndrome. And so there is some thought that we should be treating patients more like they have high altitude sickness rather than ARDS. A lot of the stuff right now is still just anecdotal. It's still conversations between doctors. There's not really any studies to officially back that up. And I don't know that Diamox has been studied or even tried. I have not heard of any studies where that's been done.
Okay, and then one of the questions here was asking, can you get it a second time? I know that's a question that keeps coming up.
It's a question that keeps coming up, and it's a little bit unclear, but right now there's no strong evidence that you can get it a second time. There have been some cases reported, I believe out of Korea, where people had tested negative and then they test positive again. And what's not clear is if maybe they had a false negative in between, or if there may be something else going on where they are able to detect the viral particles, but the person's not actually sick. So there's not a clear, again, no smoking gun here that someone can get it twice. No clear evidence that happens at this time.
Patty just asked, how safe is fresh produce at the grocery store?
So that's a good question as well. Certainly it kind of depends on how much that produce is being touched. So if you're in there in the grocery store and you're looking at some tomatoes and you're holding a bunch of tomatoes and you happen to have the coronavirus, and then you decide not to get them and you leave them there, and the next person comes in and grabs those tomatoes, then certainly you could get the coronavirus from those tomatoes. The thing to do with your fresh produce is make sure you clean it. So when you get home from the grocery store and you unload everything, make sure you clean your produce, make sure you wash your hands when you're done. Or if you're particularly concerned, leave it in your fridge for a couple of days before you eat it. So that way the virus has a chance to die off if it is really on the produce.
Okay. And Alex asked a question, what about conjunctivitis as a symptom?
So conjunctivitis can be a symptom of the coronavirus. That is something that they're seeing more in patients who are a little bit further along in their disease course or a little bit sicker. So it's not a common presenting symptom. Not saying that that can't happen. I believe there was a study in which they had one patient where the patient's first sign was conjunctivitis, but that's not a typical presenting symptom. It more often is associated with the other symptoms as well, the cough and the shortness of breath and conjunctivitis. And I believe the number on that is about 1/3 of patients have some symptoms with conjunctivitis. So anyway, that's going to be the last question for today. And thank you for joining me. And we're learning new things about this virus every day. So stay tuned on all of NBC's platforms for the latest news.